Hi, my name is Angelina Franco, and my county profile presentation will be on Lassen County. So here are some of the general demographics of Lassen County. Lassen County is located on the northeastern portion of California, which is this red location here on the map. It holds an estimated population of 30,573 people, with the majority of the population being white, then Hispanics, and African Americans. Looking at the educational level of this population, 83% hold a high school graduate, comparing to California overall as the same percentage. People who hold a bachelor's degree or higher in Lassen is 12%, while California as a whole is 33%. So I think this is pretty low compared to other counties. So here's some data on the socioeconomic status of Lassen County. There is some evidence that socioeconomic status can affect an individual's health outcome and the type of care they receive. Usually, people of lower socioeconomic status are more likely to have health problems that suffer from chronic conditions when compared to those that have higher socioeconomic status. So looking at the data from Lassen County, about 3,600 suffer from poverty, which is about 15.8% of the population. In this graph right here, it shows a comparison of California versus Lassen County on their poverty rates. So looking at the percentages between California overall and Lassen County, you can see that Lassen County is a little bit higher than California. However, it looks like it has been declining, which is a good thing. Health insurance. The majority of people covered with health insurance in Lassen County are covered through their employer, which is about 48.1%. This chart over here shows how the percentage of uninsured individuals in Lassen County changed over time, compared with the percent of individuals enrolled in different types of health insurance. One of the key things I noticed is that the percentage of uninsured people started declining, so a lot more people are deciding to get insurance. Overall, about 93% of Lassen County is insured. Living in Lassen County, community members have an opportunity to be a part of the Partnership Health Plan of California, PHC for short. This is a nonprofit community-based health care organization that contracts with the state to give out Medi-Cal benefits through their local care providers. This is to make sure that Medi-Cal members have access to quality, cost, and effective care. This graph right here has shown that there has been an increase in the percentages of both Lassen County and California have been signing up for Medicare. So some of the opportunities that PHC provides is getting care. Getting care, this is making doctor's appointments, referrals to specialists, pharmacy services, and transportation benefits. So if anybody needs help getting to their appointments, this would be one of the things that is offered. The second thing is member portal. So this is created for self-service. It's to enable access to clinical and non-clinical benefits, such as viewing their lab results, ordering ID care, or access to their benefits. The third thing is important documents. This is to look at the member handbook. What the member handbook shows is the different programs that they're able to receive for free or at low cost. Additional services would be an advice nurse line, translation services, weight loss program, and community and emergency services. So it just provides a bunch of different opportunities while living in Lassen County. Physicians. Primary care physicians in Lassen County see an average of 2,411 patients per year. So it's a patient to primary care physician ratio. This represents a 13.9 increase from previous years. So this chart right here just shows the comparison of Lassen County to other neighboring counties in California. Overall, it does not look like there has been any improvement. It looks like a lot more people are going to the doctor and not enough physicians available. Community clinics. HANC, which is an abbreviation of Health Alliance of Northern California, is a network of community clinics and health centers working together to promote the health of communities, specifically in Northern California. The picture right here shows the HANC member clinic sites. There are 12 member organizations and a total of 36 member clinic sites. So it's usually important to have a lot of clinics. That way there's access to health care for people in the community. So here's some data on the health outcomes and factors in Lassen County. I think it's really important in showing the overall health of a specific population to really see how healthy the community is and if there is any specific healthcare issue going on. So right here in this image, it shows where Lassen County is ranked on the overall health outcomes. They are ranked 42 out of 58, 58 actually being the worst. So I don't think this is a pretty good number. What I think is the reason for this ranking is the both physical inactivity and the adult obesity in Lassen County. So this graph right here shows the comparison between California, Lassen County specifically, and the US overall. And what I can see is that the percentage of physical inactivity has increased significantly between the year 2015 and 2016. Also, adult obesity has increased a lot since then as well, which they're both linked together, so I think this is one of the big healthcare issues in this community. Nutrition and food insecurity. So here I just provided data on the percent of students using free and reduced meal programs in both Lassen County, comparing it to California as a whole. Majority of this county use a food stamp program, which is one of the largest nutrition assistant programs. They provide an average benefit of $78 per month for those who have an income below the poverty line. Overall, what I can recommend for this healthcare issue is to provide events that would be fun and entertaining for the community. I think that these events should consist of games and foods that would be funded by local schools through fundraisers. Also, public health agencies could help out with these events by having educated leaders to come and inform individuals of what people could do to improve their health, especially those of higher risk for heart disease. And I feel like this would be beneficial because it would be in an environment that people would enjoy.